இப்படி மறந்து போயிட்டேன்னா நான் ஸ்டார்ட் பண்ணது அமுத்துடு. நானே அமுத்துறேன், but in case I forget when I start talking. யூடியூப்ல எவ்வளவு பேர் லாகின் பண்ணிருக்கான்னு தெரியுமா?
I think we can check that.
டாக்டர் அகிலா, உங்களால் பார்க்க முடியுமா?
Yeah, we can check that.
சரி. We can start in 1 minute, ma'am. 18:05 ஆரம்பிச்சிடலாம்.
Okay, we can start, sir.
Sir, you are on mute, sir. Yes, we can hear you now.
Yeah, it's okay, no?
Yeah. Dr. Akila, you want to start? Okay.
Okay, I will start now.
Yeah, yes, sir. Yes, sir.
Okay,
please.
we'll start. Good evening to one and all. On behalf of Computer Society of India, ACM Chennai, IEEE Computer Society Madras chapter, I have great pleasure in extending a warm welcome to Dr. Ganapathy, our speaker for today's session on technology in healthcare in 2030, a peep into the future. I also extend the welcome to my colleagues in organizing units and the delegates of this invited talk who have joined through Google Meet and watching the YouTube streaming also. Dr. Ganapathy, today's speaker, a world-renowned expert in telemedicine, is not new to our forum. He has been delivering quite a few invited talks for us during the last 2 years, and we have also joined him in several of his conferences, seminars, and workshops in the area of telemedicine in the past. Today's talk will review the current cutting-edge technologies in healthcare and extrapolate them to the next decade, taking into account the expected cultural, socio-economic, and technology acceptance as a behavioral modification. Amala, can you mute yourself? Yeah. The post-pandemic scenario with its accompanying information dissemination has resulted in higher level of health literacy and expectations. In future, insurance-enabled universal health coverage will concentrate on promoting wellness. Clinical genetics, management of the unborn fall out of space medicine, and many at present non-existent disciplines will emerge. Robotics, nanotechnology, use of artificial intelligence will be double-edged weapons. The world will turn upside down. with these technologies. Technology-enabled remote healthcare may lead to group consultations in addition to the traditional one-to-one private consultation. Dr. Ganapathy plans to end his talk with a philosophical note discussing the equality of death in the light of technology that only can postpone the inevitable. And he will also point out the dangers of forgetting that technology in healthcare should always be only means to achieve an end, and the traditional emphasizing sympathizing doctor who always provides tender loving care should not become an endangered species. The talk in a nutshell will emphasize that the future will always be ahead of schedule. Now it is my pleasure to formally introduce the speaker. Dr. Krishnan Ganapathy is a past president of the Telemedicine Society of India and the Neurological Society of India. And he was also the formerly an adjunct professor at IIT Madras and Anna University. He was a former honorary consultant and advisor in neurosurgery for the Army Forces Medical Services. In 1990, Dr. Ganapathy became the first in South Asia to get a PhD in neuroimaging and to be trained in stereotactic radiosurgery in 1995 and in robotic radiosurgery in 2008. He had ventured into telehealth in 1998 and established himself as a pioneer both in India and at the global level. During the last 46 years, Dr. Ganapathy has presented 578 papers in national conferences and 188 in international conferences. He has published 121 scientific papers, 183 articles in magazines and newspapers, and 20 chapters in textbooks. This is over and above the numerous invited talks at different forums such as ours. Dr. Ganapathy is a member of editorial board of 4 international and 3 national journals in telemedicine and neurosciences. He reviews articles for 15 national and international journals. He was a guest editor for 2 special supplements of a national and international journal and has also edited a book on health IT. Formerly, Dr. Ganapathy was a member of the advisory committee at the Department of Science and Technology, Government of India, and is currently a member of BIRAC committees. Basically, it is on Biotechnology Industry Research Council of Government of India, reviewing research projects for funding. Dr. Ganapathy is a honorary distinguished professor of Tamilnadu, Dr. MGR Medical University, Emeritus Professor, National Academy of Medical Sciences, and founder director of Apollo Telemedicine Networking Foundation and Apollo Telehealth Services. Dr. Ganapathy is also on WHO, that is World Health Organization, roster of experts on digital health. Columbia University had selected Apollo Telemedicine as a case study to demonstrate global best practices. Now, may I request Dr. Ganapathy to take over and enlighten us on the subject, the technology in healthcare in 2030. Over to Dr. Ganapathy.
Thank you, Mr. Mohan and all the organizers. It is indeed a pleasure and a privilege to be here to talk with all of you. Ladies and gentlemen, I intend to put you onto a time machine and take you with me on a journey which I'm absolutely sure most of you are going to participate. The ride may be bumpy, but I guarantee you a safe ride. So fasten your seat belts. Before I go into either technology or healthcare, let's spend a minute trying to see how India is going to be in just 9 years from now. The slide on the top left was probably how India was when I came into this world. When my grandchildren leave this world, I'm sure the photograph on the right will be India in its entirety. A CIA report several years ago mentioned that India is going to be a rising economic powerhouse in 2030. This report is more than 20 years old. We are going to be the most connected. Why going to be? We already are probably the most connected IT savvy society in the world. We will be the global leader in delivery of IT enabled services. The government has already announced that 5G is going to be available within a year or two. Continued economic growth with 1.5 billion in India, there obviously will be a pressure on energy, food, and water resources. Aging population in the developed world. But again, then 200 years ago, India and China contributed 30% and 50% to the world's wealth. Is it a case of back to the future? The entrepreneur who is primarily looking at ROI, return on investment, Elon Musk, has already set up a very small organization with 100 million plan to link brains to computers. He will not do anything unless there is a commercial element in it. The fourth industrial revolution, which we are now going through, in this revolution, there will be more robots than workers in the next 10 years. Perhaps a day will come in my lifetime when there'll be more computers. When I say computers, I include smartphones, etc., than human beings on earth. I never in my wildest dreams thought that the Reserve Bank of India will announce digital currency, will impose a tax on virtual digital assets. I think the word India will soon be replaced by digital India. Everything in India is becoming digital. Again, I never thought that liquid biopsy will be available in even all tertiary care hospitals in this country. Imagine taking 2 ml of venous blood. I'm talking of India. 2 ml of venous blood, and perhaps in the near future, diagnosing a brain tumor. Who says you require a CT scan and an MRI scan? This is what the world is going to be, and this is how we are going to get totally disrupted. Businesses, practices will shift significantly. Gamification. When my grandsons were playing video games, I was shouting at them. Being an old-fashioned person, I never thought that the Department of Biotechnology, BIRAC, of which I'm a member of several committees, we would be funding startup companies so that gamification can be used in the field of healthcare. Virtual reality, augmented reality will soon be part of a doctor's armamentarium because they can simulate real life experience. This was a report published in 2015, which said, and this is the most credentialed, the report, 800 technology executives from all over the world, no less an organization than the World Economic Forum has presented this report. And look what they say. 90% of the population of the world will have regular access to the internet. Driverless cars equaling 10% of all cars on US roads will have a separate highway. They are talking of 3D printed liver and so on and so forth. The first 3D printed car in production. This is what they are doing. Now here you can see Chennai in 2030. This has already started happening in Dubai. But I got the shock of my life when I read a newspaper item about 3 months ago. IIT Madras is recognized world over as one of the top institutions of the world. And here you can see venture capitalist angel investors have already funded $5 million as the first plan to fund an IIT startup company to develop India's first air taxi, taking off exactly like what you saw, what is being done in Dubai. Can you imagine an air taxi, a single person, a manned drone, if you want to call it? So these are the things which are happening. Again, healthcare will by 2030 be totally taken over by Amazon, Apple, Microsoft, Google, IBM, and so on. Every one of them are spending a significant part of their total income, their staff, everything on healthcare. And why are they doing this? The healthcare industry is the only industry in the whole world which is recession proof. Ladies and gentlemen, whether you like it or not, you require a doctor, a healthcare provider, even before you're born, and in 2030, even after you have left the world. Stored sperm can be used to fertilize the unborn baby. So this is what healthcare is all about. Pharma companies, what took 25 years to produce a drug today can be done in 5 years. Over the last 18 months, we have seen how vaccines are being developed. Very soon, India's first nasal vaccine, 100% indigenous, made in India for the COVID, will enter phase 3 clinical trials. And all this took place in a bare minimum period of 18 months because of computer simulation. Customized medications. There cannot be a pharma company which is not digital in every sense of the word. I would like you to look at the bottommost, whatever is mentioned here, rising expectations, that is on the left-hand side of the slide. But I would like you to concentrate on the middle. This is Gartner's very famous, well-known theory, have already met practical reality. And on the right side, you can see progressing into the near future of healthcare delivery. Wearables. This morning, I saw an advertisement which said that more smart watches are being sold in India than in most other countries in the world. Smart watches are now developed indigenously. And when I say smart watch, I'm talking of a Fitbit-like watch where you can measure the calories and the blood pressure, the pulse rate, and so on and so forth. Nutrition apps, remote care apps, clinical trial recruiting, employee wellness program. You think about it. 51 have been already identified as the top emerging digital health countries, trends even as early as 2021. Several years ago, I showed a slide. Everybody laughed and ridiculed. I asked, are you ready for a hospital without patients? Ladies and gentlemen, this is what is going to happen. No less a person than Dr. Pratap Reddy, the father of modern healthcare in India, who heads the third largest hospital group in the world, announced last year publicly that the Apollo hospitals do not intend to acquire more and more hospitals, build more and more hospitals as they were doing until recently, but instead they will concentrate now on developing satellite units. And why is that so? The hospitals in just 5 years from now, definitely in 10 years from now, by 2030, services will be confined to major surgery, to trauma, intensive care unit, and only to very serious medical conditions. A doctor in your pocket, post point of care diagnostics. I've written articles in magazines many years ago stating a lab in your pocket, a doctor in your pocket. Today, it will be a hospital in your pocket. Diagnostic imaging, laboratories, outpatient departments, every one of them will be standalone. It will not be part of a regular hospital. And the hospital itself will be like what you see here. This looks more like a resort. This looks more like a 4-star, 5-star hotel. But why not? And one author asked a brilliant question. He said, why are patients not involved in the design of hospitals? After all, it is I who occupy that room. And he's absolutely right. Hospital architects of the future have already made plans like this. These are all from journals. These are not my imagination. And this is how hospitals of the future will look, like posh resorts or 4-star hotels, for a simple reason that patients are only going to be for a procedure. Daycare surgery will be standalone units. They come in the morning and go home. Canada and America, for insurance purposes, started doing craniotomies, that is opening the skull and removing brain tumors, as a daycare procedure. This has already been in existence for several years now. Healthcare of the future, I believe, will be what I would like to call 4P. Predictive. Artificial intelligence today will be able to host big data analytics, and based on my present conditions, it will be able to very accurately predict what is going to happen to me 10 years, 15 years from now. As an individual, I am not very sure that I want to know that I will develop Alzheimer's disease when I'm 85 or 90. So there are a lot of ethical considerations here as well. Medicine is going to be personalized. Gone are the days when you prescribe capsule erythrocin or capsule ampicillin or whatever it is. Instead, you will be giving the genome of your patient will be available with all big pharmacies. The humankind probably will be divided into 1,000 groups, let us say. So I will belong to group number 1 or group number 230 or group number 999. My genome will put me into that particular group, and a 3D printing. Pharmaceutical companies will not be making millions and millions of pills. Instead, they will be making thousands and thousands of pills in each group. The poly pill companies have already spending trillions, not billions, but trillions of dollars on making the magic poly pill, a single tablet which will contain antihypertensive, anti-diabetic, and a skin disease, steroid, cough syrup, you name it. Every single thing will be customized, personalized into making the magic poly pill. Participatory medicine. Gone are the days when a nurse would take blood pressure. When I was a house surgeon and intern, I used to take the blood pressure. I used to examine the urine with a Bunsen burner. Those days are gone, and I foresee that ultrasound will be done with the help of an instruction manual and using 5G technology, a robot who has already been, after all, it's only a question of pattern recognition. Any robot, any IT programmer can develop a super program with pattern recognition. A robot will be able to tell the patient that this is a hypoechoic area, a hyperechoic area, and so on. Being a passionate Indian, I was delighted when I found that as early as June 2018, Niti Aayog, the Planning Commission of India, had already brought out a publication on National Strategy for Artificial Intelligence, AI for All. And leading this was obviously healthcare. So Niti Aayog has identified 5 sectors, starting with healthcare, agriculture, education, infrastructure, and transportation. I have been mentioning again and again, for progress to happen in any industry, you require government support. And it's absolutely amazing that today we have government support for digital care. I'm not very sure whether I'm allowed to share this, but anyhow, I couldn't help it. As I told you earlier, I'm a member of several committees of the Department of Biotechnology, BIRAC, and these are some of the presentations made to us by startup companies which BIRAC has funded. Make in India, totally made in India. You can see here, restored hearing. Today, we are able to make hearing devices at 1/10 the international cost. Point of care diagnostics, 33 tests, liver function tests, renal function tests, cardiac enzyme, you name it. Of course, it is still expensive by Indian standards, but it's just a question of time before it comes down and turning the world upside down. This is a slide I have been using for more than 10 years. You can see a preemie, as you call it, a preterm baby. Somewhere I put an arrow just to remind myself that this is where the baby is. This was how a neonatal intensive care looked like 10 years ago. This is, of course, a borrowed slide. Today, most of the quaternary hospitals in India have such neonatal intensive care. Non-invasive blood sugar monitoring will, I foresee, be routine. Of course, there's a lot of resistance from the multinational companies. As you know, glucometers and strips contribute to trillions of dollars, and naturally, it's not of commercial interest if we bypass that and have a non-invasive sugar monitoring. 17 diseases with clear biomarkers have already been identified in human breath, and I foresee that cancer of the lung will eventually be diagnosed by asking a person to breathe into a collecting device, and a biomarker will be there. Voice biomarkers. I've been talking to you now for almost 18 minutes, and based on a detailed acoustic analysis of the pitch, timbre, quality, and so on and so forth, I'm sure people will be able to predict that 10 years from now, I may have a problem with my vocal cord and so on. My cousin from the United States, a couple of months ago when she came here, she asked me, are you chipped? I didn't understand that word at all. And then she told me that people in Sweden have already becoming chipped cyborgs. And again, it's just a question of time before most of us start getting chipped. We have chips inside implanted subcutaneously. On the right-hand side, you can see how nutrition plays a very vital role. Today, we already have, these are all available. You can buy it in Amazon, actually. You can buy it. And today, a smartphone, a simple app with, of course, the appropriate peripheral device will tell you what is the content of gluten, what is the content of ABCD on your smartphone. Smart forks, smart chopsticks, food sensor, dietary chat box. It looks so ridiculous to wash a dish after you eat. Why should I spend valuable water in washing forks and knives? Why can't I just eat it? And this is what is going to happen. Edible forks, edible chopsticks, edible plates, every one of this is going to happen. As early as 2019, China announced the world's first 5G powered remote brain surgery, where a DBS, deep brain stimulation, there are at least 20 centers in India which do this now. You can implant a neurostimulator into a specific area, a patient with Parkinson's disease. The only difference was the surgeon was 3,000 kilometers away and a robot was trained how to do this. Neuro prosthesis for decoding speech. This was published in the New England Journal of Medicine, July 2021, one of the most respected medical journals in the world. I guarantee you that the peer review is so strict that this paper would never have been published unless it was 150% scientific. And you can see here how sentences have been decoded using artificial intelligence, and now they have achieved a 100% accuracy. A paralyzed man in Australia tweets using his mind after having a microchip implanted in his brain. This is not science fiction. This has already started happening. And I've been mentioning this for several years. I now use my mouse. I click on my PowerPoint icon to open my PowerPoint. I can also use my voice. Every computer has a voice activated. I can open it. But very soon, all I need to do is to look at the PowerPoint icon. After all, common sense. To look at the PowerPoint icon, my left eye medial rectus muscle must be at, let us say, 37.2 degrees. Similarly, my right eye lateral rectus must be adducted, abducted, and so on and so forth. And using sensors which I wear, the eye knows that looking at the PowerPoint icon, the brain interprets that, sends a message, Bluetooth technology, very simple, and the PowerPoint opens. So all this is going to happen very soon. Body augmentation, a department of augmentative neurology or restorative neurology has just started a couple of years ago. There are patients who are willing to pay hundreds of thousands of dollars to make them smarter physically, mentally, and so on. Brain-machine interfaces. We are all familiar with CRISPR gene editing technology, and this is now being done illegally, perhaps. I don't know whether it's ethically permissible, but again, the technology mentions that. Brain microchips, neural layers for mind-controlling prosthesis, subdermal RFID chips, and so on. We are all familiar with Parkinsonism, but imagine neuroprosthesis, where you wear a device, as you can see here, and these devices are connected to your brain. Can you imagine that? Can you imagine God-given human brain sending impulses to a neural prosthesis? Neuroengineering, I'm absolutely certain, will become a standalone entity. No more cadavers, already it started, even in India. I understand this is also difficult to get cadavers. Apollo Hospitals, Chennai, has just started a few weeks ago a very advanced simulation center which will simulate what I took 30 years to learn. The medical student of today will probably be exposed to it in just 3 to 6 months. Virtual reality, augmented virtual reality, and so on have got approval from the FDA for management of chronic pain. I remember how difficult it was for me to start a vein, to start an intravenous drip, particularly in an obese individual. A newborn baby The number, I feel so bad. The number of times I pricked that little baby because I just couldn't get a vein. Today, that is all history. Today, we have simple devices like this, which will show you exactly the vein is. And to go better, I can even get a robot to take the vein. I bet even an ENT surgeon will not be able to distinguish which is the 3D printed ear and which is the God-given ear. 3D printing of human organs is now taking place in single digits, double digits. It's just a question of time before it takes place in triple digits and in 4 digits, and eventually. And I'm so happy that Dr. Thais Rusomono has joined us here today. She's a very well-known space scientist, and I am assuming that 3D printing of human organs will be a part of the technology available in a spaceship going to Mars, because there's no other way. And if somebody is going to live in Mars for 6 months, 1 year, 2 years, etc., if he requires replacement of organs, this is the only way we can do it. So 3D printing has already become a part of our regular life. Robots and telemedicine. Yesterday, I had gone to attend a wedding in Bangalore, and I was shocked to see there were as many drones taking photographs as there were human photographers. Drones has now become app. My grandchildren are not at all interested in drones. They have seen so many of them. Many police departments in the country have their own drones, and thanks to the COVID, the number of robots manufactured by startup companies, hospitals are now using robots, not for complicated robotic surgery. We are still importing them. But as you can see here, these slides are, of course, borrowed from different parts of the world. But in a year or two, I will be using my own slides made from India. And as you would correctly have guessed, employee of the month for a gigantic hospital employing 10,000 staff is my friend the robot, because he is a disinfectant robot. He can go where no other human beings are going. Diabetic retinopathy, I think this is no longer news. There are enough papers today, enough data available to show that the program developed by Google and others is slightly better than even 5 or 6 retinal specialists who have spent an entire lifetime looking at diabetic retinopathy. There are at least 8 to 10 centers in India which have started doing clinical trials. We're using AI for the diagnosis of diabetic retinopathy. Wearable health monitoring systems, I believe this is going to be commercially viable. And of course, space technology, space medicine is going to give us a big incentive to develop this. And I understand that there are remote, of course, this is all classified information, so I wouldn't know the exact details, but I do know that in Kargil, Indo-China border, Indo-Pakistan border, etc., our soldiers are wearing wearable health monitoring systems so that if a shrapnel, a bullet, pierces them, a signal will be sent. So the central monitoring station will know exactly whether the bullet is lodged in the skin, whether it is broken to the rib, or even entered the heart, and so on. So this is what is going to happen. If you ask me, where am I going to put all my bet on? If I had $100,000 and I'm going to invest them to make a big return for the future, I would put it on genomic sequencing. I think this is going to be the most practical, the most relevant, applicable immediately. When I say immediately, within a year or two. With 5 ml of blood out of the 28,000 genes, I think India has the capability today to analyze maybe 95% or 97% of all the genetic structure with just a few ml of blood. There are at least 20 centers in India where genomic analysis is being done today at 1/10 the cost in the Western world. Smart drugs are going to be manufactured with genomic sequencing, human organs on chips. All drug trials will be in silico trials. The gone are the days where drug trials, phase 1, phase 2, phase 3, which will take 3 years, 5 years, etc. Every one of them will be done simulating it on a computer. This is another device manufactured by a startup company. You can see here, absolutely amazing. It'll come into the market very soon. Phase 3 clinical trials are just being over, and here using near infrared spectroscopy light, you can see the wound, diabetic wound on the top right-hand corner, the big toe you can see. This fantastic using optomechanics, optics and mechanics and AI, of course, the machine is able to, with a very high sensitivity, specificity rate, even say this is a gram-positive cocci, or this is a gram-negative, or there is no infection at all. So the standard microbiology laboratories will become obsolete in 5 to 10 years from now. Gone are the days of urine culture sensitivity, blood for culture sensitivity. Everything will be done using very sophisticated optics. Yet another locally made indigenous product, Kiosk, which is totally self-sufficient, available today in 12 different languages. You just talk in Indian languages and it will make a diagnosis and it will even dispense a drug. There are inbuilt safety mechanisms to ensure that the slightest doubt, a message will be sent to a physician and the physician can always override this Kiosk. Capsule endoscopy, again, as I think there are 30-40 centers in India where capsule endoscopy is being done. I have already mentioned this about the robot drawing blood. Virtual reality applications in medicine. It will take me 2 hours to complete the list. You can see on the left, training on cadavers, virtual endoscopy, colonoscopy, computer-assisted surgery, and so on and so forth. Phobias. Virtual reality is found to be extremely useful worldwide in the management of phobias. There are people who are afraid to get into a lift. There are people who are afraid to even go to a 10th floor or 15th floor and look down. Anxiety, depression, every one of this technology is used. I had already mentioned to you about prediction, prevention, and personalization. Pharmacogenomic. Now, out of genomics, pharmacogenomics is a single most important area where drugs are profiled. You can see a list of drugs where detailed pharmacogenomic studies have been done. And today it is possible, based on your genomic analysis, to change tramadol, to change glyphosate, to even change warfarin to suit what you specifically require. This is the Apollo Hospitals Hyderabad. This is a sister company of Apollo Hospitals called HNG. These are all our staff. You can see this totally indigenously made drone, which have now trials are going on now with the help of World Economic Forum. Hopefully, in a few months from now, all the permissions, everything will be granted, and vaccines will be transported. Not only vaccines, blood will be transported to the remotest villages. Can you imagine? It is inexpensive. It is far less expensive to manufacture a drone and to use a drone rather than to use a courier service. IoT solutions like IOMT, we now have IOMT, Internet of Medical Things. I foresee that every single entity of a patient admitted in a ward, whether it be monitoring vital parameters, whether it be medication intake tracking, whether it be drug tracking, you name it, hospital inventory, you want to find out where the supply chain, you want to find out where a ward is, where a wheelchair is, where a stretcher is, you want to find out whether the operation theater, when will it become free, you name it, every single function is going to be based on IOMT. Now, here again, we are talking of smart hospitals, smart technologies. Gone are the concept of working hard. Now the concept is working smart. Real-time tracking. You can use wearable bands, RFID, e-diagnostic centers, e-reports. And of course, mobile app sends patients messages about taking medicines on time. All this will be stored on the cloud and wearable devices of various types. The difference between a dog and a pig, ladies and gentlemen, whether you like it or not, is not too much. So is the difference between me and a chimpanzee. It's only 3% of my genetic profile, which is different, which enables me to give this talk. Otherwise, 95% of my genes is very similar to that of a chimpanzee and a very large percentage similar to that of a pig. Doctors have successfully hacked as the technical word that is used, gene hacked, changed, artificially modified, and used a heart, grown a heart in a pig, if you want to call it, and used that heart on a human being. Similarly, kidney transplants have been done. Common sense tells me that in 10 to 15 years, see, even as a postgraduate, if I had told my examiner that A group blood can be used for a B group kidney transplant, he would have taken back my MBBS degree, let alone my postgraduate degree. Today, we do not require blood group cross-matching. Immunogenetics has become so sophisticated, I can tinker with the immunogenetic system. So it doesn't matter if I transfuse A group blood to a person having B group. The same with other animals as well. I would just like to spend the last couple of minutes on, again, as I said, ISRO, Indian Space Research Organization, hopefully will be the fourth country in the whole world to send its own citizens into outer space. Because of COVID, everything was delayed by a year, but hopefully next year, the first 3 Vyomanauts will be transported for a low Earth orbit for 7 days. What is the fallout of this? Can a country like India, where we still do not have drinking water, where we still do not have connectivity, is it wise on our part to spend so much money on space exploration? Of course, ISRO's budget is 10% of NASA's, and I think ISRO has done almost 40 to 50% of what NASA is doing. 2 years ago, there was a symposium. I couldn't even dream that India would have a 2-day symposium with more than 300 attendees, a 2-day symposium on human space flight and exploration. 500 industries are involved in the launch of the Gaganyaan, and the Minister of State in charge of space announced just a month ago that as per the plans, India's first International Space Station, ISS, will be launched by 2030. Again, now, even though only 2 years apart, I think it was stupid on my part, but I was very pleasantly surprised. Again, with the help of Dr. Thais, we were able to bring out what, to the best of my knowledge, was the first special supplement of a journal, not only in India, but anywhere in the world, dealing exclusively with extraterrestrial neurosciences. And just a few days ago, when I was reviewing some paper, I was astonished to find that each one of these papers have been downloaded 3,000 to 7,000 times. So this shows there is definitely an interest. Again, just 2 weeks ago, the International Society for Telemedicine and E-Health have established a working group exclusively for healthcare in space and extreme environment. Now, what does this mean? This means that traveling to Mars, traveling to the moon, going into outer space is not something which should happen once in a decade. In the last couple of months, we saw at least 3 groups of tourists who went. And over the next, I'm talking of 2030. And I'm sure in 2030, the prices will come down, though it will be far beyond the reach of most of us. Still, the tourism in outer space is going to happen. The media displayed this in a very big way last year, how a NASA astronaut's blood clot was treated by a doctor on Earth. The astronaut did an ultrasound on himself as part of a research project, and to his horror, he found he had a blood clot, but no problem. The doctor on Earth actually sent the medicines because the medicines were not available. They were in the ISS, the International Space Station. So the drugs were sent. It was as simple as sending drugs from a pharmacy across the road to my house. That is what they did. The drugs were supplied. The astronaut came back after 4 months. It's about 1.5 years, and I think he's perfectly all right. I could go on and on, but I think I will quickly come to a conclusion. Now, healthcare from space down to Earth, you can see there has been a lot of fallout. Charge-coupled devices used on the Hubble Space Telescope have been converted to producing instruments for human care. And here you see programmable pacemakers, microtransmitters, etc. Detailed studies in microgravity of cells and microbes have resulted in better understanding of diseases on Earth. Point-of-care diagnostics, the smart vest, all this are actually a fallout. This is an amazing instrument. Unfortunately, Indian rules and regulations, Indian law is way behind technology. I do hope they will understand this. This particular ultrasound was devised exclusively for space, for doing studies in outer space. And you can see here on it catches a ride, as they say, on SpaceX. And this is also a very sophisticated Doppler, the size of my smartphone. And with this, we will be able to study the blood flow in most parts of the body. I foresee that transcranial Doppler also will be a reality, where we have a certain small areas in the temporal bone which still passes light. And I foresee that in the years, because of space technology, we will be able to do an ultrasound with the intact skull. Right now, we can do an ultrasound of the brain only when the skull has been removed, but even this will go away. Articles have already started appearing in peer-reviewed PubMed index journals on digital health technologies to support human missions to Mars. The future, ladies and gentlemen, is not too far away. As Mark Twain said, the future ain't what it used to be. Most of us are afraid of the future. We cling desperately to the present, not realizing that we have already become the past. Would any of us have imagined that what we enjoy today, would we have ever dreamt we would have this in India even 5 years ago? I would like to conclude on a philosophical note. As a medical doctor, of course, I've retired from neurosurgery. I'm not in active practice now. But as someone who has personally encountered at least 3,000 deaths over a 40-year period, I am worried, I am concerned that the tremendous use of technology is postponing death. I think quality of death is as important as quality of life. The Swedes have already, many European countries, particularly in Sweden, have already legalized formal euthanasia. The Indian Supreme Court a few years ago, in 2018 to be precise, recognized living wills and said that the terminally ill patient has a right to decide how he's going to die and die with dignity as a fundamental right. However, India has still not advocated active euthanasia. Many European countries today, active euthanasia is possible, and you can see how technology is already available. So what is my take-home message? If I were to summarize 40 minutes of whatever I spoke to you, I would like to say balance good and evil. You cannot get rid of all evil. Good and evil are two sides of the same coin. Never forget that technology should be a means to achieve an end and not an end by itself. Lars Lexell, the inventor of the gamma knife, which 50 years ago was the world's most sophisticated technology in healthcare, he said, I repeat, a fool with a tool is still a fool. I think it's the man behind the machine that counts, not the machine itself. This is very, very important. As one trained in the BC era, I'm not talking of before COVID, before Corona, I'm talking of before computers. I was the last neurosurgeon, the batch of neurosurgeons in India who trained and qualified before there were computers regular computers in a hospital. I was taught to listen to a patient. So William Osler said 100 years ago, he said, listen, listen, listen. The patient is telling you the diagnosis. I'm sure the most sophisticated astronaut in outer space, an astronaut in Mars, he still would like to talk to a human being. He still would like a human being to console him, wipe his tears, albeit virtually. But this is something we should not lose sight of. I am concerned that the e-patient of today, the electronic, equipped, enabled, empowered, engaged patient has already become an expert. Today, when a patient comes to me, he knows as much or slightly more than what I know, because yes, thanks to Dr. Google and Mr. Professor Facebook, facilitated by wearable health sensors, etc. The clinician will adopt AI as an integral part of his armamentarium only when there is evidence that AI betters outcomes and reduces costs. We are in a stage of transition. All transitions offer great opportunities, and I think we should exploit them. What is my picture of an ideal healthcare provider in 2030? The ideal healthcare provider should have the skill of Shushruta, the world's first surgeon, should have the compassion of Mother Teresa, should have the pragmatism of Lord Krishna, whose Bhagavad Gita is now used as teaching material all over the world, not just in India. He should have the genius of Albert Einstein. And of course, he must have the brilliance of Steve Jobs, getting into the minds of the beneficiary. Steve Jobs' success was because he got into the mind of the beneficiary, understood exactly what the beneficiary wanted. Of course, a doctor who has all these traits should be a Superman. But Superman or doubt, I would like to conclude with the last photograph on the right-hand side. This is what healthcare is all about. And in my lifetime, I hope my children's, grandchildren's lifetime, I hope healthcare will continue to show this. This is a neurosurgeon who had just corrected a meningomyelocele in the unborn, 7th month of intrauterine life. The incision you see there is in a gravid uterus, and the neurosurgeon describes so wonderfully. He says, when I was putting the fetus, the unborn child, back into the mother's womb, this little unborn baby clenched my hands and would not let it go. It was the most emotional moment for a neurosurgeon who was employing the then a very advanced technology. Just look at this photograph, this little baby clenching the finger, saying, "Thank you, doctor, you saved my life." I hope that we continue to deserve that thank you and remember that technology is a means to an end. Thank you once again for giving me this opportunity. Hello?
Thank you, sir. Now, can we move to the question and answer session?
Okay. I'll do one thing. One sec. I hope the audio video was clear and I was not talking to myself.
Yes, sir. Yes, sir. It is perfectly
See,
all
the
right.
problem with the virtual talks is I have no idea whether anybody is on the other side. Normally, when you talk face to face, you get body language. I know how many are sleeping, how many are snoring, so etc. But here, I don't know this at all.
The presentation was perfect, sir. Both audio and video. No
Okay,
problem.
fine. So my last slide was this. Challenges are what make life interesting, but overcoming them is what makes life meaningful. Now, I understand these questions were asked by the audience while they were registering for the conference. I'll
Yes,
very
sir.
quickly finish this in just 2-3 minutes. First question, 23rd with COVID question mark, answer, question mark, question mark, question mark. I honestly do not know. I don't think any of us know. But having said that, the medical profession is very sure that even if there is a COVID clone or something similar to a COVID in 2030, we would have mastered and the bad days are over. So forget about COVID. Preventive measures, this requires a 2-day symposium. What are the cutting edge technologies that a biomedical engineer should be skilled in? If, as I said, I may be old fashioned, but as one who has been in the healthcare community for 52 years, may I sincerely advise all biomedical engineers not to jump into cutting-edge technologies. You don't be a good biomedical engineer by being familiar with cutting-edge technology. Understand what is required in the real world, and you can still use what is not necessarily cutting-edge. You can modify it, change it. At the end of the day, your technology must be of use. Next question.
So then only we can understand the domain, so then we can pinpoint where is the problem occurs, and we can
correct.
systematic means of overcoming the problem. So that
is the Indian medical practice ready for a product like EMR? My honest answer is no practice anywhere in the world will at any time be ready for any product. It is up to the designers of the product to use a carrot, to use a stick, to use everything at their command. demand to persuade them, force them, whatever it is, and make the Indian medical practice ready for the product. So this cannot be a unilateral way. Having said that, yes, for the last couple of years, all of us are being slowly brainwashed. It took 20 years in the United States. I think in another 2-3 years, we will be ready for the EMR. Advancement in healthcare, yes, obviously it has an impact on patients and old people. How, it will take hours to explain, but I would reverse the process. I would say patients and old people are the reason why there is advancement in healthcare sector. So I would like you to look at it that way. It is old people who are having the necessity. Why all of you youngsters are making products? It is because there is a need for such a product. Specific area to do project, somebody can contact me, too complicated. Cyber security, yes, we are. But the average doctor, including me, I am not paranoid about security like in e-commerce, like a credit card general manager is. I am not paranoid about it. Yes, we are conscious about it. Preventive measures, future of telehealth. Need information related to microarray. I'm sorry, sir. I am a simple, as my grandson said several years ago, he said, Tata, in Tamil, grandpa, you may be a brain surgeon, but I don't think you are a brainy one. So this was what a 6-year-old boy told me long ago. So similarly, I'm sorry, I'm ignorant about microarray. Presentation, yes, I'll be happy to share it to the organizers. Portability of EHR, yes, good question. And the National Digital Health Mission, they have taken a fantastic step. They have already announced 27 of the leading players in EHR in India have all been formally invited just a few days ago. And these 27 people's EMR will be at the disposal of the National Digital Health Mission. It may take a year or two before you make it interoperable, portable, and all those sort of things. Wireless body area network, yes, that's going to be a part of, eventually it will be a part, but I really don't think it's more as a research paper, not as a commercially viable remote telemedicine. Can AI completely replace human experts in future for prediction? Never, never, never. NI is always native intelligence or natural intelligence. Please remember, it is natural intelligence which made AI. I do not think, particularly with the Indian culture, Indian background, we still require humans. And not for a long, long time in India am I ever going to see medical doctors out of a job.
So thank you very much, Doctor, for your excellent presentation and question and answer for the top webinar on technology in healthcare 2030, a peep into the future. Now, I invite
Dr. Sakthivel, just I would like to ask one question to Doctor.
Yes, please.
Doctor, all these technology development, are they affordable to the common man?
Usual standard question, and my standard answer is a solution is not a solution unless it is universally available to anytime, anywhere. Answer is very simple. I don't know how old you are, sir, but if you remember the first cell phone which came into India, came into Madras about 25 years ago, it was about 6 times the size of the present smartphone, and it had 1/100th the function of the present smartphone, and it cost 48,000 rupees. The first computer I personally bought for my son in he went to IIT in 1997. I paid 52,000 rupees, 20 megabyte hard disk, 5.25-inch floppy. Okay. So over the last 40 years, the cost has come down 100 times. Functionality has improved 100 times. So the same thing, we are in a stage of transition. Mass production, mass utilization is the only way the cost will come down. So let us not be pessimistic. Let us not, it is very expensive, so why do I do that? Be a little patient. It's just a question of time before it becomes affordable. Number two, the average Indian economy is growing tremendously. The BPL government has put 10 lakhs. I couldn't imagine that. I mean, I was not earning that much as an assistant professor of neurosurgery with so many qualifications. 10 lakhs a year is what they have put as a lower income group. So our status also is going up. So I don't take it seriously.
Okay, one more question is about gene editing.
Yes.
I mean, is it how it is going to take shape, sir?
See, this is an ethical regulatory issue. I'm not the expert again, but my general knowledge tells me that gene editing is possible today. Any top class, very well equipped laboratory can do the gene editing. But why do you want to do the gene editing unless there's a need for it? So this is more a question of ethics, regulatory issues as in 2022. Maybe by 2030, the guidelines will be very clear. But at the moment, to the best of my knowledge, many countries or most countries in the world which have the capability to do gene editing, most of them do not permit it to be done.
And
Sir,
then what about the stem cells? Have they become popular or still?
That is a very sad, in my opinion, is very sad that the media has publicized this on television, on that, on this. Again, to the best of my knowledge, there is no statistically significant improvement on a long-term follow-up. See, please understand, any intervention must be compared with with the existing gold standard, and B, with a natural history of the untreated disease. A person has stroke for 3 years, you then give him stem cells. 1.5 years later, he becomes better. But he would have got better even if you had given him a placebo, even if you had not given him anything. So unless you have at least 500 people on both arms, a double-blind randomized crossover, multi-institutional crossover study with a p-value of more than 0.01, probability value of more than 0.01, you cannot say that it is a stem cell which made the patient better. So such studies will take 10, 15 years to do these studies. So I don't think stem cell will ever be prescribed the way a doctor is prescribing laparoscopy or anything today.
Thank you, doctor.
Sir,
There is a question from Vetrivelan.
Sir, can I ask question, sir? I'm Dr. Vetrivelan from VIT Chennai. I think as soon as and when we use the term doctor, we are all engineering doctor. I'm from electronics department.
Yes,
so we work in terms of the data acquisition, implanting a different sensor like a wireless body area network, and taking those information and made available to the doctor. And let's say something like before the patient reaches the doctor, we wanted to assist the doctor in terms of the diagnosis process. Like there may be a set of data sets, and we build a model, all these things. And is it applicable for all the diseases, like chronic disease, non-chronic disease, or there are varieties of the disease. So how well the engineers can work coexistively with doctor, I mean medical doctor, and what sort of problem we can take it up. So because I may have my own assumption as an engineering person, I may build so many, but which are all may not be needed for the doctor too. As you said, doctor cannot be replaced, even though when you are going to do the operation remotely, and maybe all the infrastructure and other predictive assistive mechanism may speed up the doctor or the treatment. So can you advise on this, sir?
You don't mind if my advice is brutal. I have never been a diplomat. Diplomacy was never my forte. And this is my major complaint. Whatever I'm telling you now, for the last 4 years, I've told the Secretary, Department of Biotechnology, Government of India, Secretary, Department of Science and Technology, etc. And I'm not talking about you, sir. I don't know specifically. But generally speaking, technologists and engineers come up with fantastic ideas, very nice things, and they do it also. But my very strong complaint is, unfortunately, they do not discuss in great detail with the domain expert in clinical medicine. I have so many requests for funding from BIRAC for manufacturing dialysis machines, portable dialysis machines. They are experts on semi-permeable membrane. They have not even consulted a nephrologist even once. Now, you may make a machine, but for you to test that machine, you must be very familiar with clinical trials, with animal trials with required rules, regulations, etc., etc. My humble request to all the people listening here is, please, at the conceptual stage, right now what is happening is engineers develop the sensors, develop the software, hardware, connect, everything is ready for actual testing. Then you go to a medical doctor. That is not the way. When you think of an idea, you go to a medical doctor, discuss with him. Ideally, the medical doctor should come to you and tell you, look, these are the problems I have. I don't know how to do it. Is it possible for you to do something which will help me? There has to be a very, very close cooperation between the doctor and the engineer. 20 years ago, jokingly, I said in many of my talks, I said, I wish a medical college was inside IIT. I never realized that 15 years later, Kharagpur would have its own medical college. Kanpur is now already developing a medical college. And who knows, even IIT Madras may have a medical college. So this doctors and engineers cannot be looked in isolation. So that is my appeal to you is, please discuss with the end user. You are not the end user. You are the intermediary. You are a very important person, but you are not the end user.
Yes, sir. Yes, sir. I completely admit what is happening. As you say, the other way around is happening. So it must be in the early stage after the duly discussion with the medical expert, then accordingly to be fine tuned. Or each stage.
Of course. If I add one more comment, in all, when I mention this, the engineers who apply for funding, they tell me, and I have no answer to that. They say, sir, you are willing, you are talking, but do you know how difficult it is to get a doctor? No doctor wants to spend this time. No doctor is willing to discuss with us, which probably is equally true.
Equally true, yes, sir.
So thank you, sir. Now I invite Chairman Computer Society of in Chennai, Computer Society in the Chennai chapter.
Can I invite Dr. Thais to make a comment, if you don't mind? She is in London.
Yes, sir. Yes, sir.
Joined us. She is a very senior space scientist. If she would like.
Yes, sir.
Dr. Rusumono, are you there, madam? I saw her. Okay, if she's not there, it's okay.
I invite Dr. Priya Vijay, Chairman, Computer Society of India, Chennai chapter, for formally proposing the vote of thanks.
Thank you, sir.
Madam.
Thank you, sir. I take over. Thank you all. I thank everyone for attending this webinar on healthcare domain. I thank Professor Ganapathy for keeping all of us into the healthcare industry in 2030 with wide spectrum of information and his advice to take over the projects along with medical people. I thank our associating partners, Dr. Sakthivel, ACM Chennai chapter and IEEE Madras chapter chair, and Mr. HR Mohan, IEEE CS events chair. I thank our event management team, Mr. PV Subramaniam, immediate past chairman, and Dr. Agila, MC member, for helping us to bring this webinar into success, right from invitation to sending videos to the participants at the last. I thank all the OB members, secretary, treasurers, MC members, all the members of our associate partners who have joined to make this webinar success. I thank all the participants for their momentum to keep through at last till interacting with our chief guest, Professor Ganapathy. Thank you all, one and all, once again. Take care. Good night. Be safe. Thank you all.
Thank you, everybody.
Thank you.
Thank you, sir. Thank you, sir.
Thank you, doctor. Wonderful session. Thank you very much. Bye.
Okay, I think it was an excellent talk.
Yes, sir.
And